a nerdy deep dive into ADHD and anxiety. Picture this. You sit down for one email. Your heart's racing, leg bouncing like it's got Wi-Fi, and your brain's drafting apology texts for things you haven't even done. Half an hour later, that email's still blank, your anxiety meter's at an 8, and you're wondering, is this ADHD, anxiety, or both? If that feels like your weekly Tuesday, stick around. We're unpacking why these two party crashers love showing up together and what you can actually do. The overlap isn't just bad luck. It's no coincidence that up to 50% of adults with ADHD also meet anxiety disorder criteria. This isn't just bad luck, it's a neurobiological overlap. Both conditions often ride the same dopamine and serotonin highway, so when traffic jams, symptoms honk at each other. ADHD brings impulsivity and distraction, anxiety brings rumination and dread. Put them together, and you get a mind that can't focus because it's both racing and worrying. Genetics loads the gun. ADHD's heritability sits around 70 to 90%, but environment pulls the trigger. The result? A limbic circuit brilliant at sounding false alarms, yet always forgetting its keys. Spot the difference. Restlessness shows up on both resumes, so how do you tell them apart? Ask what the engine is running on. ADHD restlessness feels like an internal motor that won't idle. You jiggle, doodle, blurt. Anxiety restlessness, though, is usually future-focused. What if I bomb? What if they hate me? Attention problems differ too. ADHD and attention is inconsistent. You can hyperfocus when you love a task, but have zero grip when you don't. Anxiety-driven concentration is worry-laced. Your brain keeps tab switching to threat assessment. Quick self-check. If the room goes silent and you suddenly remember the stove, that's probably anxiety. If you remember the stove because you saw a squirrel, that's more ADHD. Brain science without jargon. Inside your brain, two main networks misbehave. The default mode network, think your brain's screensaver, won't shut up in anxiety, replaying worst-case scenarios. While the executive network, which should be saying, let's prioritize, is often underpowered in ADHD. Neurotransmitter-wise, dopamine transporter density can be lower in both conditions, making reward signals feel like weak Wi-Fi. Serotonin, that emotional volume knob, often runs low too, turning up background hums of dread. Essentially, you've got a race car engine trying to stop with bicycle brakes. If this is already sparking some aha moments, hit that like button. It tells the algorithm we're solving real problems here. And definitely stick around. Next, I'm handing you 3 evidence-backed moves you can try tonight. 3 tools you can use tonight. Name it to tame it, pause. When those internal browser tabs explode, silently label what's happening. This is anxiety, or that's ADHD chatter. Research shows affect labeling can calm the amygdala within seconds, buying your prefrontal cortex precious time. 4-6-8 breath with cognitive anchor. Inhale for 4 counts, hold for 6, then exhale for 8, picturing a green check mark. That extended exhale shifts your nervous system toward a calmer, parasympathetic state, and the visual anchor gives your ADHD mind a toy to hold. Just 3 cycles can cut heart rate variability spikes by 20%. Task sandwich. Take an anxiety-provoking task, split it into tiny micro steps, and bookend it with rewarding stimuli. A quick song clip, a stretch, maybe a scented candle. Dopamine hits at the start and finish help your ADHD brain lock in, while those tiny steps keep anxiety from snowballing. When to call in bigger guns. If self-talk tools feel like bringing a pool noodle to a gunfight, it's time to consider layered treatment. Stimulants can boost dopamine, but might amplify jitters. Starting with a long-acting formulation and titrating slowly helps manage that risk. SSRIs or SNRIs calm anxiety and can indirectly improve attention by reducing those worry loops. Combining these is common and generally safe under professional supervision. Therapy-wise, CBT tailored for ADHD adds behavioral activation. Think implementation intentions, like, if it's 3 p.m., then I open the report. Mindfulness-based cognitive therapy, just 8 weeks, can thicken interior cingulate gray matter, sharpening both focus and emotional regulation. Lifestyle multipliers. Exercise is probably the closest thing we have to a poly pill. Just 20 minutes of moderate cardio can raise dopamine and serotonin for about 90 minutes, sometimes even outperforming low-dose stimulants for single-session focus. Omega-3s, specifically 1.2 grams of combined EPA and DHA daily, can reduce anxiety scores by 15 to 20% and help smooth out ADHD response variability. Sleep hygiene is absolutely non-negotiable. Every lost hour below 7 equates to a 0.08% drop in working memory accuracy, which feels like a thick mental fog the next day. And yes, please cut that 4th espresso. Caffeine's half-life averages 5 hours, so that 4 p.m. cup is still partying at midnight, often masquerading as insomnia-fueled anxiety. So this storm isn't some personal failure. It's predictable circuitry. ADHD supplies the lightning, anxiety provides the thunder. But once you understand the weather pattern, you can pack an umbrella, or maybe even dance in the rain. Try the name it to tame it trick, breathe like you truly mean it, and sandwich the scary stuff between quick wins. If you need more backup, remember, meds and therapy are legitimate force multipliers. Drop a comment below telling us which tool you're road testing today. Share this with that perpetually overwhelmed friend, and remember, understanding the chaos is the first step to turning down the volume. You've got this, and science genuinely has your back. This video is for educational purposes only and is not a substitute for professional medical advice.
It's a normal evening. You're relaxing at home, maybe watching TV, when suddenly something feels off. Your left arm doesn't respond. You try to speak and your words come out slurred. You realize something is very wrong. This is not a minor issue. It's a stroke, also called a cerebrovascular accident, or CVA, a medical emergency that affects thousands every day in the US and Canada. Every minute matters, because every minute, millions of neurons in your brain die. Stroke is the second leading cause of death worldwide, and the leading cause of adult disability. Knowing what to do can literally save a life. In this video, we're going to break down everything you need to know. What happens inside the brain during a stroke, the early warning signs, and the life-saving steps you must take immediately. By understanding the causes and recognizing symptoms, you can protect yourself and your loved ones. Make sure to subscribe and turn on the bell so you don't miss critical health information. And tell me in the comments, have you or someone you know experienced a stroke? Where are you watching from? Your story matters. Let's start with what's happening inside the brain. There are two main types of stroke you must remember: ischemic stroke, which makes up about 85% of cases, and hemorrhagic stroke, which accounts for around 15%, but can be deadlier. An ischemic stroke occurs when a blood clot blocks an artery in the brain. Oxygen and nutrients stop reaching brain tissue, and cells begin dying within minutes. Hemorrhagic stroke happens when a blood vessel ruptures, causing bleeding that puts immense pressure on surrounding brain tissue. Regardless of the type, the rule is simple: time is brain. Neurons only survive a few minutes without oxygen. This is why early recognition is critical. The B-FAST test is a simple, effective way to identify stroke symptoms. B for balance, sudden loss of coordination, unsteady walking, or dizziness. E for eyes, sudden vision changes, blurred or double vision, or partial blindness. F for face, ask the person to smile, one side may droop. A for arms, ask them to raise both arms, one may drift downward. S for speech, listen for slurred or strange speech, difficulty finding words. T for time, call emergency services immediately. In the US, dial 911. In Europe, 111. Anywhere else, get to the nearest hospital as fast as possible. Now, let's explore the two major treatments that can save brain function if administered promptly: thrombolysis and mechanical thrombectomy. Thrombolysis, sometimes called the chemical clogger, is a treatment where a clot-dissolving drug is injected into the bloodstream. This treatment is only effective within 4.5 hours of the stroke onset, which is why immediate recognition is crucial. Once administered, the clot dissolves, restoring blood flow to deprived brain regions and saving neurons from permanent damage. Mechanical thrombectomy is a newer, revolutionary procedure for cases where the stroke onset is unknown or the clot is too large for thrombolysis. A small catheter is inserted through the femoral artery in the leg and guided to the brain. Using a tiny mesh device, the clot is captured and removed. Restoring circulation, this procedure can save lives and significantly reduce long-term disability up to 24 hours after stroke onset in selected cases. But all of this technology depends on one thing: you noticing the early warning signs. Recognizing a drooping face, a weak arm, or slurred speech and acting immediately is the first step in saving brain function. Delays in calling for help dramatically reduce the effectiveness of life-saving treatments. Let's talk about what can happen if a stroke is ignored. The longer brain tissue is deprived of oxygen, the more neurons die. Early signs like dizziness, mild weakness, or facial droop can progress to full paralysis, severe speech impairment, and permanent disability. Recovery becomes longer, harder, and sometimes incomplete. Stroke is a race against time, and your awareness can make the difference between full recovery and lifelong disability. Preventing stroke is just as important as early recognition. Risk factors include high blood pressure, diabetes, high cholesterol, smoking, obesity, and a sedentary lifestyle. Maintaining a healthy diet, exercising regularly, controlling blood pressure, and managing stress can all reduce your risk. Additionally, regular checkups and cardiovascular assessments are essential, especially for those over 50 or with a family history of stroke. Remember, stroke can happen suddenly, even when someone appears healthy. That's why awareness, prevention, and rapid action are critical. Share this knowledge with family, friends, and coworkers. Being prepared could save someone you love. If you found this video helpful, make sure to subscribe for more life-saving health tips. Share your experience in the comments. Have you or anyone you know experienced a stroke? Where are you watching from? Your story matters. To summarize, strokes are medical emergencies where time truly is brain. Early recognition using the BFAST method, immediate emergency response, and understanding modern treatments like thrombolysis and mechanical thrombectomy can save lives and prevent permanent brain damage. Prevention through healthy lifestyle choices and routine checkups are equally vital. Your awareness and quick action are your most powerful tools in protecting yourself and those you love. Stay informed, stay vigilant, and remember, every minute counts.
Imagine slowly losing the memories that define who you are and the ability to think clearly. This terrifying reality is the silent, ongoing threat of Alzheimer's disease. It is the leading cause of dementia and a medical crisis affecting millions of families across the US and Canada. In this comprehensive 3D medical animation, we take you inside the brain to reveal the exact biological mechanisms of neurodegeneration and explain the crucial difference between normal aging and the destructive progression of Alzheimer's. Early cognitive decline is not limited to simple forgetfulness. It includes difficulties with language, visual spatial awareness, logical thinking, and complex decision-making. Alzheimer's is marked by progressive brain atrophy, a shrinking of critical brain regions over time. Recognizing these initial symptoms is the first step toward timely diagnosis and intervention. The core of this devastating disease lies in two toxic proteins, amyloid plaques and tau tangles. Amyloid plaques accumulate outside neurons, forming sticky clumps that disrupt communication between brain cells. At the same time, tau tangles develop inside neurons, destroying the internal transport system and ultimately leading to irreversible cell death. The combined buildup of these protein pathologies drives the progressive nature of dementia and severe cognitive impairment. Early diagnosis is improving rapidly. Techniques such as spinal fluid biomarker testing and advanced PET scans allow clinicians to visualize amyloid plaques in the living brain. Current treatment strategies include medications that manage cognitive decline and new drugs designed to reduce amyloid accumulation itself. Understanding the latest Alzheimer's clinical trials is crucial for patients and caregivers seeking clarity. Although genetics influence risk, lifestyle remains a powerful tool for prevention. Building cognitive reserve through proper nutrition, regular physical activity, and mentally challenging tasks significantly lowers the risk of late-onset Alzheimer's. Managing diabetes, high blood pressure, and high cholesterol has a major impact on brain health. Awareness and early action remain the strongest form of protection. We have explored the main pathology of amyloid and tau, but the story of neurodegeneration is more complex. Recent research highlights chronic inflammation within the brain as a major accelerant. Microglia, the brain's immune cells, normally clear excess amyloid. When they become overwhelmed, they shift into a hyperactive state, causing inflammation that damages synapses and speeds up brain atrophy. This inflammatory process explains why systemic health issues can dramatically increase Alzheimer's risk. Vascular health is another critical factor. Vascular dementia, the second most common form of dementia, often coexists with Alzheimer's. Conditions such as high blood pressure, diabetes, and high cholesterol damage the brain's blood vessels, trigger microstrokes, and reduce oxygen supply to neural tissue. Maintaining cardiovascular health is one of the most important actions for Alzheimer's prevention because the health of the heart directly determines the health of the brain. Genetics also plays a role. The APOE4 gene is the strongest known genetic risk factor. Inheriting 1 or 2 copies increases the lifetime risk of developing Alzheimer's and accelerates amyloid plaque deposition. However, genetics is not destiny. Lifestyle interventions remain powerful even for those at high genetic risk. The true weight of Alzheimer's disease lies in its profound societal impact. Beyond the cognitive decline of the patient, the emotional and financial toll on family caregivers is immense. Our analysis confirms that caregiving for a loved one with progressive dementia is often a full-time commitment, demanding significant economic and psychological resources. Understanding the support systems available, from respite care to specialized long-term care facilities, is a critical component of navigating this neurological disorder in the US and Canada. The massive economic burden placed on healthcare systems highlights the global urgency of finding effective prevention and treatment strategies. To truly empower individuals, we must explore detailed, actionable Alzheimer's prevention protocols. While we stressed general exercise, specialized studies now focus on specific lifestyle interventions. The MIND diet, a hybrid of the Mediterranean and DASH diets, emphasizes berries and leafy green vegetables, showing significant promise in delaying the onset of neurodegeneration. Our visuals showcase the brain benefits derived from sustained aerobic exercise, which increases blood flow and neuroplasticity, essentially building your cognitive reserve. We must also highlight the importance of challenging the brain through complex cognitive activities, such as learning a new language or mastering a musical instrument, which strengthens neural pathways and provides resilience against the structural damage caused by amyloid plaques. Furthermore, research into the earliest preclinical stages of Alzheimer's disease is paramount. Scientists are aggressively working to identify reliable, non-invasive biomarkers that can predict risk decades before the onset of overt memory loss. Current clinical trials are exploring novel approaches, including vaccines targeting tau proteins and deep brain stimulation, moving the focus beyond merely managing symptoms to fundamentally altering the disease trajectory. This global scientific effort provides profound hope. The future of Alzheimer's treatment focuses on early intervention and personalized medicine. A new generation of targeted medications and immunotherapies aims to clear amyloid before meaningful cognitive decline occurs. Non-pharmacological interventions, including cognitive training and personalized diet programs, show promising results in delaying symptom progression. Continued investment in neuroscience research brings us closer to breakthroughs that may change the course of this disease. Understanding Alzheimer's disease, from its biological mechanisms to emerging treatments, empowers you to take control of your brain health.
Imagine waking up one morning and realizing that your own body no longer responds the way it used to. Your hand begins to tremble, your steps grow smaller, and simple movements suddenly require tremendous effort. For millions of people across the United States and Canada, this experience is not temporary. It is the daily reality of Parkinson's disease,
a progressive neurodegenerative disorder that slowly alters movement, behavior, and quality of life. Today, this in-depth medical exploration will take you inside the brain using advanced 3D visualization to uncover the true biological mechanisms behind Parkinson's disease, explain why dopamine loss devastates the motor system, and reveal the most advanced treatment options available, including L-DOPA therapy and deep brain stimulation. If you or someone you know has been affected by this condition, this information will be essential. Parkinson's disease is driven by the degeneration of highly specialized neurons located in a small region of the midbrain called the substantia nigra. These neurons are responsible for producing dopamine, one of the most important neurotransmitters that regulate movement, motivation, emotional balance, and automatic bodily functions. Our visual model shows that Parkinson's symptoms typically begin after approximately 60 to 80% of dopamine-producing neurons have already died. Once dopamine levels fall below a critical threshold, the basal ganglia, the brain's central control hub for movement, can no longer coordinate smooth, fluid, intentional motion. This breakdown in communication creates the hallmark motor symptoms: resting tremor, muscular rigidity, bradykinesia or slowness of movement, and postural instability that increases the risk of falls. Tremor is often the first sign, beginning subtly in one hand. As dopamine continues to decline, rigidity sets in, causing stiffness in the limbs, neck, and torso. Bradykinesia makes simple tasks such as buttoning a shirt, writing a sentence, or standing from a chair extremely slow and difficult. Eventually, balance problems become prominent, significantly impacting independence. Although Parkinson's disease is known as a movement disorder, its impact extends far beyond physical symptoms. Non-motor symptoms often appear years before tremors begin. These early signs include loss of smell, constipation, sleep disturbances, vivid dreams, depression, anxiety, and subtle cognitive changes. Research in the United States and Canada confirms that identifying these early non-motor symptoms can allow for earlier diagnosis and better long-term outcomes. Understanding the full spectrum of symptoms is essential for both patients and caregivers. At the cellular level, one of the defining features of Parkinson's disease is the accumulation of Lewy bodies, abnormal protein deposits primarily composed of misfolded alpha-synuclein. These protein clumps disrupt normal cell function, damage internal structures, and contribute directly to neuron death. As Lewy bodies spread throughout the brain, additional symptoms such as cognitive decline, mood disorders, and autonomic dysfunction may appear. Scientists today consider alpha-synuclein pathology one of the most important research targets in the development of disease-modifying therapies. To this point, if this detailed breakdown of the biological mechanisms behind Parkinson's disease has been helpful, take a moment to subscribe to the channel. Your support allows us to continue producing high-quality medical education content for patients, caregivers, and healthcare professionals across North America. You can also share your personal experience or your loved one's story in the comments. Your words may help someone just beginning their journey with Parkinson's. And please consider sending this video to a friend or family member who could benefit from clear, science-based information.
The current gold standard treatment for Parkinson's disease is L-DOPA, a medication that the brain converts directly into dopamine. Our 3D animation demonstrates how L-DOPA temporarily restores dopamine levels within the basal ganglia, improving symptoms such as tremor, rigidity, and bradykinesia. However, over time, the brain's ability to store and regulate dopamine declines, and patients may experience motor fluctuations or dyskinesias, which are involuntary movements caused by long-term medication use. While L-DOPA remains essential, managing its long-term effects requires careful clinical guidance. For individuals with advanced Parkinson's disease who struggle with severe motor symptoms, deep brain stimulation offers a powerful therapeutic option. DBS involves surgically implanting electrodes into targeted brain structures, most commonly the subthalamic nucleus or the globus pallidus internus. These electrodes deliver controlled electrical stimulation that helps normalize abnormal signaling patterns caused by dopamine loss. Patients often report significant improvements in motor control, reduced medication requirements, and increased quality of life. DBS is one of the most effective neuromodulation therapies ever developed and continues to transform care throughout the US and Canada. Beyond medication and surgery, comprehensive Parkinson's management includes physical therapy, occupational therapy, speech therapy, and structured exercise programs. Scientific evidence shows that aerobic exercise, strength training, balance work, and even dance-based therapies produce neuroprotective effects and improve functional mobility. Many clinics across North America now integrate multidisciplinary care teams to maximize patient outcomes. The future of Parkinson's disease treatment is promising. Researchers are investigating gene therapy approaches aimed at restoring dopamine production directly within the brain. Immunotherapy trials are targeting alpha-synuclein in an effort to stop the spread of Lewy bodies. Stem cell-based therapies seek to replace lost dopamine neurons. Advanced imaging technologies and biomarker development may soon enable diagnosis decades before motor symptoms begin, opening the door for early intervention. Precision medicine, personalized treatment programs, and disease-modifying therapies could completely reshape the Parkinson's landscape in the coming years. Parkinson's disease is not simply a movement disorder. It is a complex neurological condition that affects nearly every system of the body. It places a heavy emotional and financial burden on families and caregivers, especially in countries where long-term care costs continue to rise. But knowledge is the strongest tool we have. Understanding the neurobiology, recognizing early symptoms, accessing evidence-based treatments, and remaining informed about ongoing research empowers individuals across the United States and Canada to take an active role in their own care. As we continue to expand our understanding of neurodegenerative diseases, one truth becomes increasingly clear. Education saves lives. When people understand what is happening inside the brain, they are more prepared, more proactive, and more equipped to seek help. If this in-depth explanation of Parkinson's disease has been valuable to you, remember to subscribe, share your experience in the comments, and pass this information forward. Someone you know may be searching for answers right now. Understanding Parkinson's disease, from the cellular pathology to the groundbreaking therapeutic breakthroughs, provides the knowledge necessary to face this condition with clarity, resilience, and hope.
Parkinson's prevention. What you can do today. While there is currently no guaranteed way to prevent Parkinson's disease, decades of research from leading medical institutions in the United States and Canada show that certain lifestyle choices can significantly lower the risk and delay the onset of this neurodegenerative disorder. Protecting your brain starts long before symptoms appear, and even small changes can make a measurable difference. The strongest scientific evidence points to regular physical exercise. Aerobic training, strength workouts, cycling, swimming, and even fast walking help protect the neurons that produce dopamine. Studies show that people who exercise at least 3 to 4 times per week have a dramatically reduced risk of developing Parkinson's. Consistent movement increases neurotrophic factors, improves mitochondrial health, and keeps the motor circuits of the brain active and resilient. Another essential pillar of prevention is maintaining a brain-healthy diet. Diets rich in antioxidants, omega-3 fatty acids, leafy greens, whole grains, berries, and olive oil help reduce inflammation and oxidative stress, 2 major contributors to neurodegeneration. The Mediterranean or MIND diet is strongly associated with a lower risk of both Parkinson's and other neurological disorders. Environmental toxins also play a major role. Exposure to pesticides, industrial solvents, and contaminated groundwater has been linked to higher Parkinson's rates across North America. Whenever possible, choosing organic produce, using protective equipment, and avoiding contact with harsh chemicals can significantly reduce toxic exposure. Sleep is equally important. Deep, restorative sleep helps the brain clear harmful proteins, including abnormal alpha-synuclein. Chronic sleep deprivation increases inflammation, damages neurons, and accelerates neurological aging. Finally, staying mentally and socially active strengthens the brain's resilience. Complex learning, reading, problem solving, social engagement, and cognitively challenging hobbies build neural pathways that help protect against neurodegenerative decline. While no single strategy can fully prevent Parkinson's, combining exercise, a healthy diet, toxin reduction, sleep regulation, and mental stimulation can dramatically improve overall brain health. These habits support dopamine-producing neurons and provide powerful long-term protection for your nervous system.